A patient today asked about the non-pharmacologic treatment of anxiety disorders, and specifically they had a fear of heights and really a phobia of riding in elevators, and that was affecting them and caused them distress when they had to do certain things, and for example, even come to our visits here. My office is on the 14th floor, and so it made it rather challenging or distressing to come in for their appointments. And so what we talked about was what I believe is one of the most effective forms, or the most effective form of therapy for anxiety disorders, and that's exposure therapy, part of cognitive behavioral therapy, or CBT. And exposure therapy, what that is, it's when someone actually does what's the least comfortable in the moment when they have an anxiety disorder or a phobia of a specific thing. It's to force yourself to be exposed to the thing that makes you most anxious, and to do it over and over again until you actually get to the point where you start to feel bored about exposing yourself to that thing, and see that your anxiety comes down, see that you survive that exposure, and then you start to feel over time less distress from being exposed to that specific thing that causes you the anxiety, the distress. That process of being exposed to something over and over again until you're no longer, you're really desensitized from the additional distress that you feel from it, is actually called habituation, which is an important part of exposure therapy. And so for this individual who was scared about taking elevators and scared about heights, we approached this by having them for a couple of weeks, maybe 3 or 4 times a week, riding in an elevator from the first floor to the second floor over and over again, and go up and then go back down over and over again until they actually started to feel bored about doing that. They did that for a few weeks. Then the plan was to move to riding that same elevator from the first floor to the 3rd floor or the 4th floor and back down over and over again until they got bored. And then a few weeks later, several times a week, to ride that same elevator to the 5th floor or 6th floor or 7th floor and back down, and repeat over and over again until they started to get bored with that, until they finally were able to get to the 14th floor and come into our visits without too much additional anxiety or distress. And again, if you feel that any of this information pertains to you in any way, be sure to talk directly to a mental health professional.